Hi, Prof. It's a privilege talking to you. We at present at a tail of the second wave of this corona pandemia. Do we expect a third wave, and when?
So to actually say when is not particularly easy. Almost certainly we will have another wave, and unfortunately it's going to be related to the way people behave. We are approaching Easter. The last wave was stimulated by behavior changes that occurred over Christmas and New Year. And unfortunately, we have now opened up meetings like religious meetings and other type of gatherings to up to 100 people, all of which can be super spreading events. Unfortunately, we are unlikely to have achieved any form of herd immunity over the short term, because to actually vaccinate the whole population will take probably the whole year in order to do so. And added to that, the variants have actually now appeared, which have meant that there is less resistance to the infection if you actually have had an infection prior to this.
The blood bank data that show that basically 50% of people were exposed, doesn't that point to maybe an earlier herd immunity?
Yeah, we're concerned about this concept now of herd immunity, only because of the fact that it still appears that, for example, the Johnson & Johnson vaccine is 57% effective in preventing mild or intermediate severity disease. But if you contract those, you still could spread the disease to other people. The big thing that we're hoping for, though, is that we will see significantly less people in hospital because of the reduction in hospitalization and mortality, which is seen with these vaccines. Specifically with the J&J one, 85% reduction in hospitalization and severe disease and 100% reduction in mortality.
Prof, what can we do to prevent the effect of the third wave?
Well, probably the most important thing is going to be to vaccinate as many people as we can and continue to educate people with regard to proper preventative measures in the community. And that means that you would want them to wear their masks. And that still is suboptimal in terms of the way people actually wear them. They are still wearing them only on their mouths or their chins, and they're still pulling them down when they talk to each other at close quarters. And you don't need to sneeze or cough on somebody. It can be just that you're talking to them at close quarters. And that can, of course, result in transmission fairly easily.
Speaking of the vaccination, is the vaccination safe?
And there are actually lots of vaccinations, and we're going to have access to many of the different types. The initial one we got was the AstraZeneca one, and then that one unfortunately did not have data with regard to the prevention of severe disease or mortality, in other words, death. The J&J, which utilized an older age group of people, did have data regarding the prevention of mortality and death that I mentioned before. Now, those are adenovirus vector vaccines. In other words, they use a virus that we have not been exposed to before that has been taught how to make the spike protein of this coronavirus. And that spike protein then, once it's made in the body, will cause the body to actually form and make antibodies itself. Then we actually have and that also applies to the Sinovac, the Chinese one, and also the Sputnik as well, the Russian one. The novel ones, in fact, are the messenger RNA ones, and those are the Moderna and the Pfizer ones. And the Moderna and the Pfizer ones have the ability, or you will inject a messenger RNA which will get into your cell and will instruct the muscle cells into which it's injected to make a spike protein. So you're not using a virus there at all. You're just instructing our own muscle cells to make that spike protein. But that messenger RNA then rapidly disappears because it doesn't have an enzyme called a reverse transcriptase, which allows it to make more of itself. So it will, once it's made the spike protein, and you now are going to be making antibodies to it, the messenger RNA actually disappears. So now you say, well, are they safe? Well, we've been using viral vector vaccines for years, and yes, they are safe. As I said, had mine yesterday, and there are side effects. I've got a sore arm. Sometimes you might get a fever, you might get a headache, but all of those things last about 24 hours. And there are very few other side effects that actually occur. With the messenger RNA types, the biggest side effect appears to be anaphylaxis. And there is currently a rate of approximately 5 per million who develop anaphylaxis. But that's less than penicillin. And so long as you're aware of the fact that some people might get it in a population like ours of 55 million, that's about 25 people who are going to end up getting anaphylaxis. So other than that, the side effects are minimal.
Yeah, so we will monitor patients when we vaccinate them for reactions. How long will the protective effect of the vaccination last?
Well, that's of course also an unknown. We have seen that protection appears to last for up to 8 months in people who have had infection before, but it also depends upon whether you actually develop new variants and whether those new variants will decrease the ability of that vaccine to protect you. But the issue there, of course, is that all of the companies are currently modifying their vaccines to cope with the new variants which are escaping the antibodies that we currently make. And therefore, it may well be that we're going to end up giving a vaccine on a yearly basis, much like we would do for the influenza vaccine.
If we speak about influenza with the winter coming, do we still vaccinate our patients for the normal influenza?
So very definitely, particularly because of the fact that there is evidence that taking the influenza vaccine actually primes your immune system to protect you against developing severe COVID. So there is a benefit from that point of view. Although interestingly, there has been a significant reduction in the number of cases of influenza because people have been wearing masks and are less likely to expose others to their virus when they become ill, because they are considering the fact that that may well be corona, and as such they are more likely to quarantine themselves.
The last question, Prof. How soon after receiving the corona vaccination can I have my flu vaccine?
Well, of course, it doesn't really matter. You can have both and it's not a big issue. But it's also not a great idea to be walking around with two painful arms, one on each side, or if you inject them both on the same arm, it's going to be a very sore arm. So I would suggest that you wait approximately 2 weeks between receiving your vaccination and the influenza vaccine, but they don't interact with each other and they don't cause a problem. One does not cause a problem for the other one. I've had corona and it wasn't nice. And I would advise everybody to get the vaccine because you don't want to be one of those people that ends up with severe disease. Remember also that we have lost at the moment 780 or thereabouts healthcare workers, and the number of people that have actually died in this country is way in excess, in fact, of the official number, because we have these patients that have been dying but are excess deaths that have occurred also, but unrecorded as being coronavirus as well.
Thank you. I had at some stage more than 50% of the patients that I ventilated in our unit were younger than me, so that was the scary thing.
Very much so. So definitely, please, if you get the opportunity, take the vaccine. There is a belief, in fact, that the corona affects only the elderly. That really isn't the case. And in fact, obesity in this country is probably one of the major risk factors in terms of the likelihood of severe disease.
Prof, it's been a pleasure talking to you. Thank you, Prof.